Okay, so yeah, I'm the Chief Operating Officer at CQC, the Care Quality Commission, and we are the health and social care regulator for England. And I think we're quite in quite a unique position as we have that oversight across the entire health and social care landscape end to end, which puts us in quite a unique position to sort of see what's going on. So what I thought to do today is I just talk through some of the learning or some of the experiences we've had in relation to COVID, which has driven us to innovate at pace. Some of the things we're doing to support innovation in the sectors that we regulate. And then finally, I was just going to move on and talk a little bit about what we're doing internally at CQC, embracing innovation through technology, people and process to ensure that we are an efficient regulator both now and into the future. So COVID, I think you could call, do you want to move my slide on, please? Oh, next slide, please. Next slide. It's not moving. Anyway, I'll carry on talking. Hopefully the slides will catch up. So COVID, I think you could describe it as a traditional disruptor in all senses of the word. It has completely thrown out most processes that we are used to using and has required us to change and adapt at pace. It's forced us to adopt new and different ways of working and has resulted in innovation and redesign at pace. We have been no different in this respect in terms of CQC. What COVID did was meant that we had to suspend all of our planned routine inspections where our inspectors are out normally crossing thresholds, looking at seeing how care is being delivered on the ground. We had to stop doing that because we were not able to get across thresholds. We didn't want to be a disease vector, particularly in areas where we've got a lot of vulnerable people who would be shielding. But we still had to continue to provide our regulatory oversight. So we worked with providers, and we were concerned that some providers may be struggling because they are experiencing things that they'd never had to experience before. But we also had to ensure that we couldn't just go away and leave them. We had to ensure that we were able to act where things of concern, or where we were aware of things of concern, or indicating that there were risks of actual or possible harm, breaches and breaches of human rights. So in order to help us maintain this oversight, even though we were not able to visit like we would normally do and inspect, we pulled together our data. We developed at pace a risk-based insight tool, which is based on some of the work that we've been doing around generating more intelligence. We pulled that together, which was pulling data together from different sources, such as previous inspection data, death notification data, whistleblowing and concerns reported into our contact centre. This then pulled all our data together with an algorithm, which then ranked our providers in order of potential risk. We then used, based on our new Microsoft Dynamics software platform, we then built structured questionnaires, which enabled us to get on the phone and have not virtual inspections, but on the face-to-face conversations with providers to really assess how they were coping with COVID, particularly focusing on things like PPE, staffing availability, and infection control. It's been really helpful for us as a learning, because it's enabled us to really test out some new ways of working and really enable us to think about how we can start to regulate differently moving forwards once we get out the other side of COVID. As well as our response to COVID, we've seen quite a lot of innovation in the sector as people have had to respond at pace to new ways of working. If you are interested, you can go onto our website where we've collated some of these examples together. But there's a whole range of things, from relatively straightforward things like GPs using sort of FaceTime to conduct virtual video calls to support care homes, to some more innovative areas using tech and machine learning and things to help move things forwards. But there's quite a lot on our website if you're interested. I think one of the things that we've noticed is that I think technology is here to stay in the health and social care sector. It's a growing area, and one that is increasingly complex, and one that is increasingly prevalent. But I think it'd be fair to say there's still quite a long way to go before services are truly transformed end to end. I think what you see now is we've got innovation at certain points within an organisation. So, for instance, somebody may be able to get an electronic X-ray, or you can use your tablet to give feedback on care in your home. But that end-to-end pathway still remains the same. And we haven't gone through that. The sector hasn't gone through that true digital revolution where sort of data and technology is at the heart of how people consume and use services, and really can smooth that pathway through. I think we're starting to see that, but I think with the sort of fragmented nature of healthcare, with multiple providers and multiple commissioners, we need to see more people coming together to work across boundaries, to share information, to improve that end-to-end quality of care. One of the things that we do as a regulator, one of our statutory duties is to promote improvement. And one of the ways we do this is to collect case studies to share best practice, to encourage health and social care services to improve. Our publications, if you go on our website, there's quite a few publications, and one of our publications is on improvement, which highlights some of the great examples of innovation, which is being put to use in the care sector. If you're interested, you can go and have a look, but there's some really interesting things happening at the moment. So automated triage, things like teledermatology, where GPs can send images of suspicious lesions to consultants, which results in speedier diagnosis and many patients being discharged without actually having to ever attend the hospital. Things like home monitoring of care, particularly things like hypertension in pregnancy, again enabling women to stay at home and not needing to go to hospital unless they need to. I think use of digital records, I think if you look at the health and social care sector, it's traditionally been services delivered in place-based silos, and records not transferring between one provider and another, not following the patient. That's starting to happen through digital technology. The electronic patient record system is now sharing patients' records across hospitals, between hospitals, and with primary care to promote that joined up healthcare system, which also enables patients to have their own access to their records to see what's going on. And though it may sound like a small thing, that's quite a massive step forwards in terms of improving that patient journey through the system. So I think as a regulator, sometimes we can find ourselves playing catch up as our legislative frameworks do not move and evolve at the same pace as the pace of change in the sector. And at the time, some things, so if you take online providers, for instance, at the time our legislation was written, online providers had not even been conceived. So we often find ourselves in a position where we're trying to regulate where our legislative framework it can be either a blocker, or we have to think creatively in order to enable us to do that. Regulating online providers is a case in point. We had to adapt how we regulate to ensure that these services provide the same standards of high quality care that we expect to see from traditional providers. So what we did was we recently completed a programme of inspections of online primary care providers. We inspected all of them. And although there are some contextual differences to consider between services delivered remotely and in person, the fundamentals of good clinical practice apply, and we were able to use our normal frameworks to assess the standards of service that are being applied with online providers. And we found that 97% of providers were meeting the regulations around being caring. 90% of the providers were meeting regulations around responsive to people's needs. However, safety was the greatest area of concern where we need to see the greatest levels of improvement. Specific concerns we had around this were areas where we had inappropriate prescribing of antibiotics or high volumes of opiate-based medicines without really talking to the patient's registered GP and getting a full clinical history. Unsatisfactory approaches to safeguarding and data protection, not collecting the patient information and sharing that properly with patients' NHS GP, and also providing inappropriate prescribing of medicines for long-term conditions. I think we've been working with providers through in our regulatory capacity to drive up standards, and I think we've found that we're seeing an improvement in this area, but there's still more work to do. And I think this is going to become increasingly important for us as digital triage becomes an increasingly important part of NHS general practice. And we will continue to work with the sector to evolve our methodology to ensure that that online providers can deliver services both safely and effectively to ensure good quality care for the end user. I can't talk about innovation without talking about artificial intelligence. It's one of those areas that is a massive growth area in health and care. It's increasingly prevalent in clinical practice, and it really has the potential to transform how health and social care is delivered in the future and improve the quality of care that people experience. We want to encourage this beneficial type of innovation whilst ensuring that it's developed and implemented in a way that keeps people safe. We have to work in partnership in things like AI. We don't regulate AI directly. It's the MHRA's role to make sure that AI applications work as they're supposed to. But we have an important role in regulating how health and social care services use AI to deliver care, ensuring that the resultant care is safe and of high quality. We've been doing some work to ensure that new types of care using AI, we can understand them, and we're developing some new approaches around called sandboxing, where we can work more proactively with collaborators who are doing these innovative things, so we can understand what they're doing and how we can regulate it. I'll come on to talk about sandboxing in a second. We're also working with partner organisations, including MHRA and NHSX, to help set a coherent and effective regulatory framework for all AI, from the development of those initial ideas to deployment in the health and social care providers. And I think for us, this is a key area for us, working both collaboratively with other regulators, but also working with providers at an early stage, so we can understand how that translates into delivery into the social care settings, to ensure that we're able to support it effectively. So sandboxing, what is sandboxing? So some of you may be familiar with the term sandboxing, but it was created by the Financial Conduct Authority to tackle new and emerging types of financial services in a more agile and responsive way as a result of the sort of fintech industry revolution, if you like. We have adopted this model as a way of learning in a safe space. The aim of it is to provide a set of tools and dedicated governance environment for regulators to handle new types of potentially disruptive innovation in a safe way. It reduces the turbulence time for innovators in sort of developing relationships with regulators, and reduces our sort of regulatory and policy development cycle, so we can learn as we go. It also helps governments tackle new innovations that are currently unregulated in a safe way, and helps sort of move the sector forward in a way without it becoming a bit of the Wild West. So we want to, while we're doing this, we really want to encourage and not block innovation. We don't want to become a blocker, but it's really important that we, as a regulator, we understand these new services, and we need to work to make sure we can understand how to regulate them, as well as just understand what they do. So sandboxing provides us with this way to work with providers in a safe and collaborative environment to support the introduction of new services into health and social care. For us in CQC, we're often not working with new providers. They're often providers that are already registered with us, such as big NHS trusts, but they're doing new things in new ways, and they're adding new things to their registration. So we need to work with them to understand how they're going to implement these services, What are the barriers and the gaps that are in place to prevent them from delivering safe and effective care? And what do we want to work with them to understand and learn a bit more about it? So what have we been doing? So we at CQC have run a number of sandboxing events. We've worked collaboratively with providers, tech companies and other regulators. And this has really helped us to speed up our policy development cycle, enabling us to iterate as we go to ensure that regulation is fit for purpose and doesn't become a blocker, but is also supports innovation and, really importantly, and enables people to stay safe. I think through this process, we've been honest about what we do know and what we don't know, and what we need to do to improve and what we need to do to enable effective regulation in this system. So we ran 3 rounds, a digital triage round, a machine learning and diagnostics round, and a care at home round. And what we've done through these is really work in a new way for CQC to explore this area in a bit more detail. So in terms of our digital triage round, what did we look at? We wanted to ensure that digital triage is able to keep people safe, is effective and up to date, is caring, is responsive to act when people are seriously unwell, and is well led through the implementation and the ongoing delivery to ensure that the right processes, the assurance and the quality improvement properly embedded in the system to ensure that people don't fall through the gaps and people continue to experience high quality care. So, sorry, do you want to move on to the next slide for me? So, in terms of the digital triage piece. So, digital triage, for those of you who aren't aware, is the opportunity for people to have a consultation either over a screen or on a chat to basically assess their condition and then decide what is the right route through. And what we looked at through this one, this digital sandbox. Sorry, if you want to go through to this, that's the slide. That's great, thank you. What we looked at through this one is a number of areas, but the things we wanted to ensure were good and in place to ensure effective delivery of safe services were safety controls. So in this digital triage, could clinicians override the system if appropriate? Could they get under the algorithms and enable if they were concerned that it wasn't working or that people it wasn't giving the right outcome? So was there an override button? What happened? Could patients actually access services in an alternative way if necessary? So, not everybody has access to a digital service. Not everyone is computer literate. So what were the other provisions if they were going down this route? What else was available to ensure people's access to service wasn't lost? What was the accessibility for patients? Was it easy to get hold of? Was accessibility criteria built in, such as making sure it worked for hard of hearing or for people with visual impairment? Could people actually use the service? Was it really complicated, or was it actually just like going and ordering something from Amazon? So how have they assessed that? And then actually the appropriateness of the clinical pathways was something we also looked at. Was it delivering the right services for the right people in the right way? So we worked with both providers and the deliverers of the services, the tech companies, and the other regulators in the system. And what did we find for this one? So I think with this one we found that providers and systems need better guidance and support when contracting for digital services. They needed to be able to be those expert partners, if you like, to be able to be a good client. We need to be able to clarify for people using the services the types of tools that are available and how they should be used, so people were clear about their routes through. I think governance government needs to develop standardised tests of effectiveness and how to triage these algorithms so we really could understand and validate what we saw. And we need to take the opportunities to improve care using insight from these tools. We also need to work with the other regulators. So, for instance, NICE is considering whether we do something around accreditation for these to sort of provide us a gold standard, if you like. The other area that we looked at through our round 2 was machine learning in diagnostics. So some of you may have heard of how diagnostics is being used now. Machine learning is certainly becoming more prevalent in this area. Things like reading MRI images, both for scans and cancer scans. MRI so far is showing that it can read images faster and more accurately than the human eye. So we again ran a sandbox to explore this one, to understand a little bit more about it and how we might regulate it effectively. I think we again had similar sort of concerns around the right pathway and workflow to ensure that people were safe. Understanding the performance of the tools. So how did we know that the machine learning was actually learning the right things and not learning the wrong things and starting to give false readings? So what was the sort of checks and balances in place? I think there's some issues that still need to be resolved around with the Information Commission's officer around the legal basis for using people's data to improve algorithms. It's an area that is evolving, and we need to ensure that people's data is still safe in these scenarios. And actually, the capacity, the capability to manage and support from senior leadership teams. These are new skills and skills that have not traditionally been available or prevalent in the sector, and we need to ensure that where these services are being deployed, there is sufficient skill and knowledge to enable them to be managed and supported effectively in live running and in terms of the leadership piece. And what would we like to see happen as these start to evolve to ensure that care remains high quality? So I think we want to see some assurances that providers have confidence that their machine learning applications are not autonomous, that they have oversight in terms of the development and how they learn to make sure that they are still accurate. We want to ensure that we can start to work with other regulators to develop standards for providers so that we are able to monitor and detect when things go wrong. I think there are some interoperability bottlenecks, and again, we need to work with NHSX, who need to work with providers to ensure that seamless flow of data can work effectively and isn't getting stuck in the sort of digital superhighway where different systems are unable to talk to one another. And I think we also need to ensure and have that visibility around developing better ways of measuring and validating machine learning device performance. It is a bit of a black box science, and for those of people who are not technically aware of it, it's sort of one of those things that it's quite hard to understand what the machine has learned from the start of when it was set up to where it's got to, and how it's learned and improved its performance, and what are the decisions it's made. And I think as a regulator, we want to be able to have confidence in that and see better visibility. The third sandbox we are running is around care at home. These closed to applications in October, and we've reviewed the applications and informed all the applications of the outcome. Unfortunately, we've had to put that work on hold due to COVID, but we are looking forward to getting that one up and running to really understand how technology can support care at home, particularly around the Internet of Things, to remote monitor people, particularly with things like dementia, to ensure that they're still moving around, they're fit and healthy, they're eating regularly. Things like that is certainly an area that I think is going to grow and can have huge benefits to enable people to stay well cared for in their own homes for longer. So I think this is going to be a really interesting and important sandbox for us moving forwards. So what I thought I'd do now is just talk a little bit about CQC and the work that we're doing in CQC. So in order for us to maintain, to continue to be an effective regulator and able to keep pace with the pace of change in the sectors we regulate, we also have to evolve and develop and embrace technology too. We have a fairly extensive transformation program at CQC, where we're looking at developing digital services. We're embracing technology to really help us move forwards as an organisation. I'll just give you a couple of examples of some of the work that we've been doing recently. So one of the things we've been looking to do is to transform our registration services. So registration is the start of the regulatory process for providers. It's where they come to us to basically register what they want to do. We check to make sure that they are capable, fit and proper, and are suitable to be put on our register. It's quite a convoluted process. It has been traditionally quite painful in terms of lots of bits of paper, lots of bits of things going backwards and forwards. And what we're doing is digitizing this service, making it an end-to-end digital process, so it's simpler and faster and easier to register with us. And we have our first live services in private beta at the moment. We want to make it easier to get it right first time, so that we can get good quality services onto our register quickly. This at the moment is an end-to-end service where we've still got some back-end work in back office work with people checking things. Our ambition for this service is for it to become a self-service for those lower risk transactions, such as adding or removing a location, or adding or removing a partner, using machine learning and artificial intelligence to enable people to basically make simple changes to their registrations themselves once they're registered. That's work in progress. It's a big program, and we're quite excited by that, as it really is embracing the sort of new ways of working, and I think is one of the first of the digital services that we've rolled out to users. Other areas that we're working on is we have understanding how people consume services, the quality of services they receive, how they've experienced them, their general, getting some feedback on that is really important to us at CQC, because at the end of the day, we're here to ensure people get good quality safe services, and we want to know their experience. We have developed an online platform called our Citizen Lab, which does now enable us to have two-way conversations between CQC and various audiences, and this gives us that real two-way opportunity to run questionnaires, to gather views and ideas. Enables us to segment populations really easily, to enable us to pull information together, and it's easy to use. It gives people feedback, and good feedback, so the continuous feedback loop is in place. So if people do comment, they get feedback on what we've done with that. And I think it's a really helpful way for us to start to embrace and harness the knowledge of users of services in our regulation. And it's certainly something that we want to do more of. As you can imagine, in CQC, we have a lot of transactions. We are starting to look at how robotic process automation can really help us manage some of these high volume repetitive tasks. Just to give you a bit of an example, we process about 1.3 million transactions a year, which are very straightforward. Do more than that. Actually, we process a lot of transactions, but we reckon about 1.3 million of these are very simple, high volume, repeatable tasks that could be could be done by a robot rather than our colleagues sat there cutting and pasting from one document to another. This has been particularly important to us during COVID, where our notifications on deaths in care homes has gone through the roof, and we've had to do quite a lot of work to manage and process that information in a timely way to feed into the national statistics being captured by ONS. What we're looking at is embedding this. We've started to build the robots, and we're looking to get this up and running and live during July and August. We reckon we'll save a minimum of conservative effort of about 36 hours per day as a minimum, just in terms of just this cut and pasting of information, and it'll enable us to do it quicker and hopefully to a more consistent quality as well. So again, we're quite excited about that. As part of all this work, CQC is coming to the end of its current strategy, and we are looking at developing our new strategy. We want to ensure that our purpose of making sure people get high quality care remains. We know sometimes we don't get it all right. Sometimes we know we must be more relevant and responsive. And we know we need a better picture of care quality across an area, a system and pathway. So we are, with this program of change that we have, is looking at how we can address that. We are building, so we talked earlier, we're building quite a big digital capability to enable us to harness the data that we have and others have, to enable us to take a better view of risk in the system, to enable us to understand where providers may be needing a more regulatory oversight than others, and enabling us to look at how we might flex our regulatory toolbox on the basis of our data and our risk, and using that to sort of drive some of our regulatory decisions. So we're building our capability with this big program of work to enable us to both effectively ensure we meet people's needs and ensure that we are able to regulate in a smart way, so that we are able to use our resources to best effect, to focus those resources in the areas of highest risk, to support innovation and development in a way to ensure that the sector can continue to evolve, continue to improve, and we are able to regulate effectively alongside it. So just before I close, just a final few messages from me. I think it's fair to say that the health and social care landscape is not static in any shape or way. It is evolving at pace. It is embracing new technology and new innovative ways to deliver care. And it's important that we are able to keep pace with that. New technology and innovative service models are going to be part of this. They're here to stay, and it's important that we understand them and can regulate them effectively. We want to encourage innovation, but we don't want to encourage it at the expense of quality or person-centred care. And we need to work closely with providers of these services and the tech companies to ensure that those key outcomes are still maintained. We always will put people at the heart of all decisions about how care is delivered, and that is important that continues. We need to ensure that we continue to welcome discussions with anyone who wants to be part of the journey, and that we are open to new ways of doing things, and we're continually learning in this area. We're not the expert, but we just want to make sure that we are capable of asking the right questions and supporting providers to do the same through this technological age that we're going through. It's important that as providers continue to evolve, we work alongside the people who use their services and those who provide them, to ensure that our regulatory partners encourage improvement and stay abreast of technical developments and other innovations. And we continue to continuously refine our regulatory approach, so we are able to provide effective regulation and oversight whilst encouraging innovation in the sector, to ensure that more people get high quality, safe care. Thank you for listening. I hope that was a very quick run through of the vast topic of innovation.